My name is Dr Vuk Jovanovic. I'm the medical director of the Tree of Life Fertility Clinic in Los Angeles, California. And I've been doing fertility medicine since 2007. And I initially worked in the US, then I also worked in Europe, and I've seen that Europe has less options for parents. So the nice thing about working in the United States is that everyone who wants to have a child can have a child. So given that we have all the options of doing egg donation, surrogacy, we're able to help almost anyone under a certain age. The only limitation that we have is that the parents shouldn't be too old. But other than that, everybody who wants to have a child can have a child. I think the great thing in the United States and in Los Angeles is that we can help everyone have a family, and that anybody who wants to have children, we can help. So it's probably one of the best jobs you can have, creating families and helping people achieve the dream of parenthood. The inspiration for this is the joy and the happiness that the patients have once they have their child. Surrogacy is when another woman carries the child for a parent that doesn't relate to her or not for herself. So initially the surrogates were getting pregnant using their own eggs and donor sperm, and basically the child was then given to the intended parents. More recently, we call it gestational carriers. The surrogates are getting pregnant with embryos that are derived from typically the intended parent and the intended mother, but in some cases we also use egg donors or sperm donors. So surrogacy is basically whenever the carrier of the baby does not carry the baby for herself, but intends to give the baby to the parents who want to raise the child. Nowadays, we don't perform typically surrogacy where the surrogate uses her own egg. So in the vast majority of the cases, the surrogate will carry the embryo that is derived not from her egg and not from her partner's sperm. Surrogacy has been around for very long. Surrogacy is acceptable, and the big advantage of doing surrogacy in California, for example, is that the courts have always sided with the parents. So the legal system and the legal framework in California is very surrogacy friendly. So the parents have a lot of legal safety when they're doing surrogacy in the United States and specifically in California. And that's why we have so many international patients coming to us for this type of treatment. The legal framework is that the court gives a pre-birth order before the child is born. So the parents generally will have court order that makes them the parents at birth. So this way, as soon as the child is born, the parents can be officially placed on a birth certificate of the child, and the child will basically immediately be their child, and they don't have to go through any adoption process or any other legal procedure to become legal parents of the child. The ASRM is a society that provides guidance and recommendations on treatments for different fertility situations, and they also provide ethical guidance on surrogacy. So the fertility clinics in the US, they have very clear guidelines, and it's very ethical to do surrogacy in a very ethical way. The egg donation process in the United States begins with finding the proper egg donor. The nice thing is that the parents in the United States have a great selection option. They can select an egg donor and use a family member. They can also select an unrelated egg donor from any of egg donor agencies that exist in the US. So they have a wide variety of options when choosing the egg donor. They also can see pictures of the egg donor at least, and sometimes the egg donors are also open to interact with the parent either by Zoom or in person. So the parents can and the egg donor can decide how much contact they would like to have. Generally, the egg donors do not have any legal rights. It's typically the birth mother or the surrogate, and in the case of a surrogate, it would be the intended parents that have the legal rights over the child. Generally, there is very little legal rights that are transmitted by the egg. It's not like the sperm where the father has legal rights. Whoever provides the egg generally will have no legal rights on the child or anything else. Generally, when the egg donor donates the eggs that are retrieved belong to the parent. So as soon as the eggs are retrieved, these eggs are then given to the parents for their use. In the US, it's not required to have a biological connection with the child. In some countries, though, and this is why it's important to talk to a family lawyer in the country where the parents like to have their child, what kind of connection is required between the parents and the child. Generally in the US, there is no biological connection required for somebody to be the parent of the child. Well, only the father that actually provides the sperm will be the biological father of the child, but generally the other parent, the other father, will also have legal right as a parent. And this is pretty much in the US and in most of the countries where the legal court orders are accepted. The children born in the US will typically have the US citizenship, and they also will acquire the citizenship of the parents that are basically either then giving us the egg or the sperm for creating the embryo. So the legal situation will vary from country to country in Europe. We have patients from Germany, France, Italy, UK, and other countries in Europe, and we have family attorneys that can provide advice to these parents how to navigate the legal system in their own country, because the legal system is truly different from country to country. The parents have the least problem in the US because they're legally recognized parents in the United States, but then they have to work in parallel with an attorney in their home country so they can bring the child back and have no legal problems with that. I think what's also important to say that our fertility clinic supports the international parents in their native languages. We have several German speakers in our clinic. We have French-speaking personnel. We have Korean, Chinese, Japanese language like Farsi. We have Russian speakers. So we can support the parents in their native language. I think that's what the parents like when they come to us. We have an associated surrogacy and egg donation agency that can provide egg donors and surrogates to our parents. We also work with many other agencies in Southern California and beyond, so the choices that we can provide to our parents are almost endless. The FDA, they provide guidance, and we have to follow certain transplantation laws. Whenever we take somebody else's sperm or eggs or embryos and put it into a person that is not intimate with the source of these tissues, the FDA has certain rules that we have to follow, like FDA blood tests, questionnaire, physical exams, and it's meant to prevent any transmission of any infectious disease to the recipient of their tissues. So we explain to every parent that comes to us how to navigate the FDA system and how can we clear their tissues so they can be used by someone else. The standard of care in the US is obviously one of the highest in the world, and that's why a lot of parents will choose to come to us for treatment. Even though US is certainly not the least expensive, it's probably the most expensive place for surrogacy and fertility treatments, but the level of transparency and involvement of the parents cannot be matched anywhere else. So the legal protections in the US are geared towards protecting the rights of the intended parents, and generally California has been always siding with the parents. In the US we have case law. It means that the decisions of the judges are based on previous cases, and generally the case law in California over many years and decades now has been to side with the parents in any question when, for example, the surrogate wanted to obtain any rights over the child, or if there is any contested parenthood. Generally in our clinic, it doesn't matter what type of relationship you have with your partner. We help homosexual couples, heterosexual couples, single parents, so the status of the relationship does not impact the options of what treatment you can do. So, for example, single parenthood is something that is completely normal for us. We have single women, single men wanting to become parents, and that's also possible. Anybody who wants to have more information or wants to become a patient in our clinic is welcome to contact us. You can contact us by phone, email. We typically can arrange Zoom consultations easily, so the parents can reach out to us from the comfort of their home. And I think that's a big benefit, that you don't have to go somewhere. We're very flexible with time and how the parents would like to interact with us. You just have to make the first step and reach out to us. So don't be shy, reach out to us.